Respiratory health concerns in Malawi. We don't know how many people in Malawi struggle with respiratory illness, but we do know the most common causes. Pictured below is an X-ray image of a patient with pneumonia, inflammation of the lungs. This causes reduced lung capacity. Some diseases of the respiratory system are caused by infections with bacteria or viruses. Others are not infectious and are caused by a combination of genetics and the environment. Some respiratory diseases are acute, meaning they will be cleared up by your immune system. Other respiratory diseases are chronic, meaning that they have to be managed over a long period of time and have the potential to do tissue damage. Some general terms that refer to inflammation of the airways include rhinitis and bronchitis. Rhine means nose, bronch means windpipe and airways, and itis means inflammation. When your airways are inflamed, swollen, producing extra mucus, and constricting your airways due to an infection or allergy, the doctor may say you have acute bronchitis or acute rhinitis. Many types of viruses and bacteria can cause acute rhinitis or bronchitis, and most don't last long and are cured by our immune systems. Chronic respiratory system problems caused by infectious viruses and bacteria include TB and HIV-related infections. Our immune systems have trouble clearing these infections. TB causes damage to the lungs directly because bacteria replicate there. HIV can be the underlying cause of pneumonia or Kaposi sarcoma of the lung. TB and HIV often occur together because one infection makes people more susceptible to the other. Infectious diseases were discussed in the presentation about immunity and infectious diseases. The most common chronic respiratory diseases that are not caused by viruses or bacteria include asthma and smoking-related diseases. Asthma affects both children and adults in Malawi. Asthma is a long-term inflammation of the airways in the lungs. It is caused by a poorly understood combination of genetic and environmental factors that cause allergic responses. Inflammation of the airways sometimes leads to swelling and obstruction in the airways. While the exact causes of asthma are not known, it is generally believed to be caused by a combination of genetic and environmental factors. Some triggers include allergens, chemicals, gases, dust, and exercise when air is cold and dry. People with asthma experience wheezing, coughing, chest tightness, and shortness of breath. People with asthma are sensitive to triggers in the environment that cause asthma attacks, inflammation, and airway blockages. Blockages of airways lead to decreased rate of airflow. The rate of airflow is commonly measured with a peak expiratory flow rate meter, a tool that measures how fast someone can exhale. The rate of exhale varies for someone who has asthma and decreases when they're triggered. Asthma is treated with drugs that cause the bronchial passages to dilate or expand. In Malawi, the most common treatment is inhaling salbutamol using a spacer, though doctors may choose other drugs depending on the patient. This child in Malawi is inhaling salbutamol through a spacer made with a water bottle. Some adults have respiratory diseases caused by smoking, such as COPD and lung cancer. COPD, or chronic obstructive pulmonary disease, is a very common smoking-related disease. The structures of the lungs are also called the pulmonary system. Lung cancer is cancer of the lungs. It mostly occurs in smokers, but it can rarely occur in non-smokers as well. A COPD diagnosis means that there are long-term air obstructions in the lungs, and this leads to heart damage. The two main problems leading to COPD are chronic bronchitis, inflammation of the airways, and emphysema, destruction of the airways. Both are caused by toxins and smoke. COPD can lead to heart failure because the blood going from the lungs to the heart is oxygen poor instead of oxygen rich. Over time, the right side of the heart enlarges, and the cells begin to die due to lack of oxygen. This condition cannot be cured, but quitting smoking and treating with inhalers can help. Lung cancer is another smoking-related disease. Toxins in cigarette smoke cause an increased rate of mutation in the cells lining the airways. Lots of mutations is a large risk factor for the development of cancer. Treatment for lung cancer depends on what stage the cancer is in. Treatments include surgery for cancer that has not spread beyond the lungs, radiation for before or after surgery, chemotherapy, which is used to shrink a large cancer or if it is spread to other organs, and immunotherapy, which allows the immune system to attack the cancer, usually for people with advanced cancer that has spread. Cancer is also discussed in the presentation about non-infectious diseases. What is carbon monoxide poisoning and how can we prevent it? In order to answer this question, we have to take a closer look at red blood cells. Red blood cells carry oxygen from our lungs to our tissues, and carbon dioxide from our tissues to our lungs. Carbon monoxide is a poisonous gas because it binds to red blood cells much more tightly than oxygen or carbon dioxide. If a lot of your red blood cells are bound by carbon monoxide, they will stop transporting oxygen, and your tissues become hypoxic or oxygen-starved. A lot of the symptoms of carbon monoxide poisoning come from lack of oxygen in the brain. Carbon monoxide poisoning is especially dangerous because carbon monoxide is odorless and colorless, so we cannot perceive it. 6 main symptoms to look out for include headaches, nausea, dizziness, breathlessness, collapsing, and loss of consciousness. What are the sources of carbon monoxide in our buildings? In scientific terms, incomplete combustion of carbon-based fuels produces carbon monoxide. In common English, when we burn most fuels without enough ventilation, carbon monoxide can form and be trapped inside. For safety, plenty of air has to go into and out of the burning fuel. Without proper ventilation, any of these can be deadly sources of carbon monoxide inside. Incomplete burning of fuel in fireplaces, furnaces, stoves, and space heaters, vehicle exhaust fumes, and clogged chimneys. When burning fuels, we must be careful to vent the exhaust or fumes or smoke outside. Carbon monoxide poisoning is treated with 100% oxygen. Over time, at high concentration, oxygen will displace the carbon monoxide on the red blood cells. One negative outcome of respiratory failure is the loss of consciousness. If breathing stops, the heart may stop beating as well. If this happens due to respiratory failure, it is important to get medical help immediately. If a person has stopped breathing but their heart is still beating, artificial ventilation can be used to blow air into a victim's lungs. The rescuer presses their mouth against that of the victim and blows. If it is available, a mechanical device can be used to blow the air. Cardiopulmonary resuscitation, or CPR, combines mouth-to-mouth resuscitation and cardiac compressions to deliver oxygen and artificial circulation to an unresponsive person until medical help arrives. Cardiac or chest compressions are the priority in CPR. CPR is a life-saving skill that everyone should learn. CPR is a skill that should be taught by an official organization that has trained educators with models. Pictured below is an image of a model that can be used to learn resuscitation of newborn babies. This model can be used to learn how to perform CPR on an adult. Here is a photo of people learning how to perform CPR on a model.